There she is. Yay.
I'm on. Yay. Okay.
Okay, so it wasn't me.
Yeah, no, I think it was just Instagram having a hiccup. So good to
Uh,
see you again.
yeah, it's good to see you too. I was just about to say what my background is, but I'm more than happy to introduce you to my followers since they really don't know very much about you, or
Yeah,
less
I'm
maybe they
assuming
do.
the people here are mostly your followers. Like, where is everybody coming from? Is it from California?
No, well, full circle, Rebecca. She's in New York for sure. I know that. I don't know. Like, I think probably from different places. I have people follow me from like pretty much all over the world, which is super cool. It's like one of the few things that I really love about IG. But so just like real quick, do you want to talk about like your background because it's quite unique?
Sure. I am by trade a physical therapist, and I am in the East Coast, so North Carolina side of things. And I have most of my career has been in a veterans hospital. I actually still work there now, um, and will be in the foreseeable future should there not be any cuts.
Oh,
That about.
no,
Um,
they need you. They need you.
I actually am one of the faculty members in the National Active Management Pain Program, but I am heavily involved in the field of chronic pain, and that is largely because it is obviously a pretty common thing in the United States, but it is especially prominent and very common in the veterans um, world just because they have so much complexity to their history. It's not just, physical stuff that they've gone through. They also have emotional, psychological traumas. So the world of chronic pain is sort of my passion and also just kind of what I live and breathe.
Yeah. So totally unlike me, who like just fell into it kind of by accident. And I, by all means, do not have the extensive background and knowledge that you do and experience. I feel like I'm just really new in this world. And so I actually had to go like get research myself because I had chronic pain people coming to me and I'm like, this is a different beast. So before we dive into that, do you want to tell us like what would be considered chronic pain?
Yeah,
Because it's different.
yes, for sure. You've actually described kind of a spectrum of people, which I'm sure you see kind of fluctuate. But in the very bare bones of things, chronic pain is roughly defined as if you've had pain longer than 3 to 6 months, and that obviously is really, really broad. It can cover a huge spectrum of people.
Mm-hmm.
So you'll have people who are actually who have chronic pain, meaning that they have pain that has lasted more than 6 months, and they are well served actually approaching pain from a pure movement perspective. So
Mm-hmm.
you're likely to see, and you can talk a little bit about this, Kim. You'll likely see like you'll work with them and they're like, oh my gosh, I'm feeling better. They seem to get better pretty quickly. Maybe not so much.
That's not my
That's
experience.
not your experience. Um, so I mean, and maybe it's the world that you're in, because like if I see someone who like gets better within like a few exercises or a few weeks, and I don't see them again, they don't fit in the spectrum of pain that needs to be coming from more of a whole person approach.
Mm-hmm.
The longer pain is, the more that there are multiple areas of pain,
Mm-hmm.
and the more that pain seems to also be triggered by other things like weather or
Mm-hmm.
stress, then that is when you're falling into the boat of pain that we would call it nociplastic pain, but you can maybe hear diagnoses like fibromyalgia. That is when pain tends to be a lot more stubborn, and it, generally speaking, is rarely a movement only approach. Movement is definitely part of that puzzle, but it's not the only thing. I don't know if you had any thoughts on that.
So yeah, like I said, I'm sort of new to it. And when I say that they don't get immediate relief, like they do, but then there's a lot of fear base around movement. So I feel like that was yes, there are a big spectrum. And in that case, I do recommend all the other stuff, but I limit myself to my movement world. But even even with chronic tightness and even disorders like fibromyalgia, I find like those I can kind of tackle from my movement specialist background and experience, like kind of know how to manage that. I feel like the chronic pain people where, like what you're saying, sensitivity to weather, sensitivity, like simple movements that they've done all the time, or definitely what I like to say, it's like a chronic hypersensitivity to their nervous system. And I always say, like, I don't know where in the nervous system it is. Like, I'm not a professional in that regard. I definitely know that, like, there's a disconnect as far as coming from movement, when their nervous system senses, like, it freaks out. And it might be like what we would normally be like, oh, that felt a little bit weird. For them, it's like send in every army red alert, like a 10 fire red alert. And it's like the world is ending internally. Like, it's like the sky is falling. Yeah. And so I find that was really unique, that I was dealing with, where I was like, maybe I'm out of my scope. But I really do feel like there is a space for movement specialists to work with that. But it was a learning experience, and it was also continues to be a learning experience. So should we start right in?
Yeah, I mean, I think we're kind of hitting some of the points already.
Kind of.
If you're here and you're wondering, why are my favorite mobility drills, my Pilates exercises not helping? Why, what's happening? Why do I continue to be triggered? Or why can't I seem to make more gains than even though I've been working on this thing forever and ever? So Kim and I are talking.
Also, there's a lot of Pilates people, there's mobility too. There's a system and an approach, and those two things can get in our way. We could use them, but they can get in our way as movement teachers or even students.
Yeah, absolutely. Kim has shared a little bit on just the different sides of Pilates, and maybe you can speak on that a little bit. But I think I really loved what you said on how when you work with mobility, it's not just working with mobility. It's actually also working with the nervous system. So I'd love for you to just kind of jump in on what you mean by that, and how you approach that with your clients.
So yeah, that goes for standard for every person that's coming to me, whether it's the pro athletes that I worked with today, or if it's my chronic pain people. I'm always thinking about the nervous system and how we're training with it or against it or pushing it. I guess the first thing I want to talk about is when I'm dealing with a chronic pain person who may or may not know they're a chronic pain person. The first thing that I talk to these people about is resetting. So it's not about don't come to me and think we're going to fix your pain. We're going to fix your alignment. We're going to fix your posture. We're going to fix the way you move. It's we need to let that go. And we just talk about resetting. And so primary thing is breathing. My chronic pain people, I've not met one yet that knows how to take a full inhale, exhale. That is problematic for a whole rainbow of reasons. So we focus on getting good expansion through the rib cage, how to keep the spine upright and not have to exhale and contract, we talk about those things, and I give them some breathing techniques depending on how well or not well they are able to get past a 3-count inhale. And then we talk about movement that will help reset. So this is where it's mobility. We talk about moving things that aren't moving. And I don't know if probably not for you because you're dealing with more traumatic injuries, fully physical traumatic injuries as well. But most of my chronic pain people, guaranteed it's neck, shoulder, or even lower spine, but it's almost always related to spine. So we do a lot of reset, learning how to check in with our neck and our spine. Most people just go, oh, I do this stretch and then I do this stretch. And it's like, no, 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 no. We have like 7 vertebrae in our neck, and I want you to learn how to just check in. We lie down on their back, and I teach them how to check in with each of their vertebrae. I do it as well with them, but that is really strictly that I got from like the mobility system, from the FR system, and it's not like something that they go hand to you on a plate. It's just I use the system to help me learn how to integrate the mobility in the neck, and I teach them like what to feel for, and I also teach them like there is no right or wrong to this. We are just trying to get things moved. I'm trying to teach you to listen how to like feel what's not moving. But like if you do it and you're like, oh, I don't know if I did it right, like there's no right or wrong at this point. We're just trying to get you to move. We're just trying to figure out what's not moving. If you can feel it, awesome, just stick with that. Like you don't have to do the whole thing. Just keep it simple, make it easy. And then again, other mobility drills that I do, like moving the scapula and stuff. I talk about how to do those things, but also if you're feeling the nervous system react, like if you feel it pinch or you feel it like all of a sudden you don't feel better. Okay, there's a way around that, or we back it up a little bit, or we just kind of tease it a little bit and then we wait, or we long term, there's other stuff related to this, but like, okay, how can we support your body and do this movement? So a lot of times like arms are fully supported on a desk or a table or a chair, or you're fully on your back, or you're on your side and you're just trying to rotate the shoulder, like, but also communicate with the nervous system in the sense that like I find that when they move, they sort of move like wet. I say like a wet noodle, like kind of like wet spaghetti, like this kind of atrophy feel to it. So I try to get them to like hold some good tension and just move to where you're feeling like safe. And if you don't feel safe, that's it. Then we're backing out, we're done, or maybe you try again another day. So I hope that I tried to teach them, like, you can listen to your nervous system, but you don't have to let it freak you out. You didn't break something, you didn't injure something, you're not broken. Like, you're like tuning in, like, hey, nervous system, what's going on today? How are we feeling? Not so good. That's okay. We're just going to try to move. And hopefully over time, it starts to work with that movement. Like it goes like, oh, I do feel better. You're right. Let's continue moving, and we can progress from there. So, Tawny, what do you have in regards to that?
I actually really love all the words you're sharing, because truly, like, what you're describing is an exploration in what that is. And because all of us are pretty individual, right? Like there's no one rule that makes sense for everybody.
Oh,
yeah. And when it comes to like, it has to look like this, it has to feel like this, it can often lend to making the other person feel like they're wrong, which can actually make you more more tight, more tense. You're like, oh no, like I'm doing this wrong, and I'm gonna freak out. Like your system actually gets more triggered when it feels like it has to obey these rigid rules, which is, on the flip end of it, a pretty hard thing for people to swallow, because we're built in this world where like, do it like this and like this, and sometimes the person
and it has to be in this system on this track.
Right, exactly. But the person with chronic pain might feel a little bit actually unsafe with that idea too, because they're already in overwhelm most of the time, like when it comes to physical stuff, pain stuff, emotional stuff, or whatever. And sometimes it's nice to feel like you have a rule, which totally makes sense. And we want to realize that when it comes to movement and comes to pain itself, it's about exploring your own body and what your body signals are saying. So there's got to be some level of balance between, all right, this is how we're going to do it, and I'm going to actually let you play and sense into that. What does this feel like for you? How to explore this? And the word safety, I think you use, is really key here, because people don't feel safe when it comes to pain. Like the question when they ask is this if this is wrong or this is right, what they actually mean is this safe? Am I going to harm myself? I'm going to
Mhm.
hurt myself,
Mhm.
right?
Yeah. And I, when we first get started too, I do say like, there might be something that we do that it has a reaction to. And it's not to say we're never going to do that. We should not do that. But it definitely means that like maybe we have to approach it differently. Or just one technique that I had to learn was, because in mobility training, we use a lot of like isometrics. And that was just too much. I couldn't do that with a particular range unless we stretched it for like 2 weeks straight and we were like feeling safe. And then it was like, okay, then we're going to do like maybe baby isometrics. And that takes a long time, right? So there is no like, it's hard to increase movement and range if you're always going to ram up against the nervous system, because the nervous system is going to say, oh, I didn't like that, let me take a little bit more range away from you. And you're, so I feel like that was a learning curve for me, because I didn't know that. Like, I didn't know people could have that such a huge reaction.
Yeah.
So Tawny, let's take it to you. What are some of the things that you spot or recognize, oh my gosh, the nervous system is totally fighting back right now?
Yeah, it's actually, it's interesting. I think there's lots of different cues that might come up, but the most common one is that people start to like get really tight in their jaw. Like they'll clench their face, they'll grimace,
Mm.
or they'll hold their breath, right? And some of that is maybe the mentality that people have with exercise movement. Like if I stretch, I have to stretch all the way to the very end, as far as I can go, and like really maximize this thing. Even when their body's feeling really uncomfortable, they're still pushing and pushing into it. And they don't realize necessarily that they're guarding until I go, wait, can you just breathe a little bit? And they're like, oh, I didn't even realize I was holding my breath. Which is sort of a good example of the mind-body disconnect. People have their body cues telling them this doesn't feel good, this doesn't feel good, and they're like, well, muscle through it, right? And it's just kind of like a push-through mentality that we learned over time. So learning the nervous system cues can be as simple as, is my jaw tight? Like, do I notice like my mood shifting? Like, what does fear feel like? Because I might actually be really uncomfortable with this exercise, but because Kim is telling me to do it, I'm like, I'm just gonna do it exactly like that. And you're ignoring that body check in. Your body's like, maybe we back off a little bit. We want to find like a nice, yummy spot of of teasing into a little bit of challenge, and without completely disregarding what our body's saying, because there's a level where it can be challenged and not lose complete sense of safety.
Yeah. And I think it's hard because well, my chronic pain people, when they come to me, it's really quite obvious. So I already know like, oh, we have a different session going on today. But like, you know, for actually increasing mobility, we do have to get uncomfortable and we have to push the nervous system and stuff. But I feel like you have to recognize when you're not dealing. I don't want to say it's like not an abnormal nervous system, but I definitely feel like it's a hypersensitive nervous system. And I find that has been hard to know. It's been difficult and challenging, like when you know you can push with a chronic pain person, because you do have to increase their ranges because they're having problems because they have their nervous system over the years has just been like, we're going to take this away and we're going to take this away. And then suddenly you only have like this much range and you're like, but I need to be able to reach to the top shelf and not feel like I'm going to spend 4 days like taking medicine because I'm having so much pain here. So, I feel like that has been challenging. Like, but again, I've been using the like 2 week sort of stay the same, don't change too much rule, and that has been helpful. But what are what are the problems that can arise that you find by piling on exercises and pushing that nervous system too much like that?
Yeah, the biggest one is just more pain. You'll
Yeah.
notice people have more stress, they'll have more pain, they have less motivation. Like, and honestly, the physical body isn't changing that much just because you're adding on more. Like,
Mm-hmm.
you know, it's the whole idea of like more is not more. And your system is so stubborn. When you push it to, let's just pretend you pushed it to the end range, but it was super uncomfortable there. Guess what
Mm-hmm.
it wants to
Mm-hmm.
do? It goes right back to your
Mm-hmm.
normal
Right
range
back.
because like it doesn't want to
Yep.
do that, right?
Mm-hmm.
So if you're continuing to tease and tease and tease and you're not seeing any changes, chances are your nervous system is saying to you that this is not safe for me. I don't like
Mm-hmm.
it, and I'm not going to go
Right.
back there, even if you
Yeah.
push me there multiple times.
Yeah. Yeah. Just real quick, so that before you talk, I like to talk about it like I sometimes refer to it like it's like someone comes into your home and like rearranges all your furniture while you're away, and then you come home and you're like, why is my furniture not the way I had it? Like I feel like our nervous system kind of does that, where it's like, what did you do? Okay, now I have to put everything back and I'm pissy about it. So I kind of feel like I like to put little personalities to our nervous system when I'm talking to my clients, kind of like you know, you got to work with them. You can't just, and they were like, oh, that's a weird analogy, but okay.
Yeah, and I think that's a really good one because the truth of it is our systems don't like to change. It doesn't matter what kind of change, if it's a good change,
Right,
like a
I know.
dietary change or whatever, it's just like, no, this is new, I hate it.
Yeah.
And and you really have to warm it up to the idea that this is okay, this is good, and then repeat it gently and often enough that it is encouraged to move in that direction.
Okay. We have a question about, oh, see, Rebecca, I actually was like, I don't want to touch on hypermobility, but we have a question about chronic pain and hypermobility.
Ask
Um,
away.
well, that's the question. Question about chronic pain and hypermobility. So we do have a series coming up, and that was one of the topics that we were going to approach. But then I was like, there's a lot of hypermobility people out there. Like, I don't want to step on any toes and pretend like I'm anything. But Tawny, if you want to say something on that, she said, sorry. No, don't apologize. No, 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 no.
We can tease the idea.
I think it's a great thing. I have my personal experience in that regard. I think people, I'll just speak for myself, like people think that mobility is like increased ranges. I disagree. It's about restoring joint mobility and stability and strength. So where that falls in the spectrum with hypermobility, it's whatever the joint is telling me. So I mostly don't, I don't take a different approach in the sense that like I'm not stretching, but maybe I utilize different aspects to work with the nervous system. It kind of depends. One of my chronic pain people is also hypermobile. And I feel like we do a lot of joint mobility work, but on a very scaled back level and constantly with trying to find tension. And I know that sounds weird, but the tension is where they feel stable. It's like then the nervous system is connecting. It's like, oh, okay, I do feel stable. So for me, that has been a game changer. And Tawny, what about you?
I just want to make sure that I understand the question because I know
It just
I
says
think you know the question.
question about chronic pain and hypermobility. I think just like what I guess maybe your approach would be, or I don't know. It just says chronic pain and hyper. Maybe she'll
Sure.
pop on, Rebecca, if you want to like clarify what you're talking about, but maybe generalized.
So in a very, very general way, what
Yeah.
what we're going to do is almost always giving what that person lacks. And
Yeah.
typically speaking, when it comes to hypermobility, it's lack of control. They don't
Mm-hmm.
feel safe with the movement and they
Mm-hmm.
don't have control over the movement.
Yeah. So
Hypermobility is a very wide spectrum for
exactly.
sure.
Here we're talking the same thing. I'm totally in agreement with that. So um let's see, Tawny, did you have anything else that you wanted to say as far as like nervous system cues or clues that we could be giving more respect that too?
Yeah, no, I think we covered pretty a wide range, right? It's like it's number again, it's just about paying attention to subtle things that your nervous system might be saying. If your body's balking at something, it's not something to ignore. It's something to slow down and check in and be like, okay, what is this about?
Mm-hmm.
And there might be multiple reasons, right? Like
Right.
because the thing that Kim and I are both emphasizing for those of you that are watching is that mobility for mobility's sake, without really understanding why your system is balking at something, is something to explore. Because sure, it can be something feels tight, and it's often something feels unsafe. Is it
Mm-hmm.
is it lack of safety over the movement? Is it lack of safety over, hey, I'm in this environment, I don't really know this Pilates studio, and I'm just getting to know Kim. I'm feeling unsafe. And actually that changes your physiology. Your
Mm-hmm.
physiology does not feel like it can actually flex as much because of what it's perceiving in the environment.
Mm-hmm.
So your favorite mobility exercises, your Pilates exercises, of course, they're awesome. And are we taking into account what the nervous system perceives about that specific exercise? Are we taking into account what that person perceives about the environment, the world, about themselves? And those are some things that we want to look at. And I think it actually feeds into what we're going to be talking about next week.
Yeah. Yeah. So, I mean, I think that ties it up for today's live, right? I think so.
Yeah, because I think next week we are going to be diving
Next week.
into. Oh, sorry. Okay. 2 weeks from now.
2 weeks from now.
We're going to be talking about the problem with having perfect form in Pilates and pain, which we'll dive in a little bit deeper into some of the things we touched upon today, and how rigid rules actually is your pain's best friend. So hope you don't miss it. If you have other questions, feel free to drop them in the comment chain and when Kim posts this video. Otherwise, we'll see you in 2 weeks.
Yeah, hopefully I'll figure out how to do all of that. But yes, thank you guys for tuning in. And we got hand raises from Rebecca, who asked the chronic pain. But yeah, if you have any questions, and again, go to either one of our pages and, DM us, ask us questions, and we'll be talking on the back end as well. And anything that you want to for us to kind of talk about or cover in this whole series that we're doing. So thank you, Tawny, for joining, and I thank you guys for joining.
Good to see you.
Bye.